Thank you for joining us for our Wellness 101 talk on a healthy metabolism. My name is Darcy. I'm a pharmacist at Red Cross Drug Store. I personally want to thank the owners of Red Cross Drug for educating the pharmacists here on subjects like this. We hope that you will enjoy this discussion that we're about to have, as well as some of the others that will be coming along shortly. Okay, so let's talk about achieving a healthy metabolism, reducing cholesterol, blood sugar, and diabetic risk. We need to give a little shout out to our pharmacy student Brian Nguyen, who helped us with this presentation. Additional material has been added to his original presentation. The objectives today are to touch on diabetes, as having a healthy metabolism is a great way to prevent diabetes. We are going to go very briefly over the pathophysiology, clinical presentations, diagnosis, risk factors, complications, management, and prevention. However, the main focus of this today is going to be on building a healthy metabolism, which does help diabetics as well as people that are trying to prevent diabetes. This is a basic slide I like to start everybody off with, just to get a really good foundation for what happens when you eat sugar or carbohydrates. And it's part of what I like to try to get people to understand is that a sugar is exactly like a carbohydrate to your body. Your body does not know the difference between the two. If you have a handful of pretzels in one hand and a handful of jelly beans in the other, they are both going to raise your blood sugar every bit as fast. So pretzels are just like jelly beans to your body in the end. It's really good to understand all simple carbohydrates like potatoes, bread, rice. All those simple carbohydrates are just like sugar to your body. So what happens when you eat a carbohydrate or sugar? It goes to your liver, and then from your liver, four things can happen. It can be used immediately as sugar for energy. That utilizes insulin for most cells. It can also be made into glycogen, which is a storage form of sugar for later use. Or it will become cholesterol or triglycerides. So one of those four things is going to happen when you eat sugar or a carbohydrate. Cholesterol and triglycerides are fats. It makes them so they are fat soluble. They do not mix in our blood, which is mostly water, and so they must be encased in a protein in order to travel through our bloodstream. So when you take a cholesterol and a triglyceride and you encase it in protein, it's called a VLDL, or very low density lipoprotein. This is the very bad cholesterol. What happens when cholesterol ends up in your bloodstream, it's encased in protein, it's called an LDL, which is the bad cholesterol. Most of you have heard these terms from your doctors asking you to try to reduce those levels. It's really important to realize that the kind of cholesterol that is made from excess sugar or carbohydrate intake is easily oxidized, and it increases the risk of cardiovascular disease. Much more than cholesterol that simply is eaten in food could increase your cardiovascular disease risk. So, for instance, cholesterol from an egg is a very good cholesterol that is not easily oxidized and is actually a very healthy nutrient that our body needs. We need cholesterol to make every hormone that our body has. We need cholesterol for function of our brain. So to have some cholesterol is very important. This next slide, the progression of diabetes, is a really great slide to help you understand most people don't actually diagnose diabetes clear until phase 5. And so it's really important. Let's talk about keeping our metabolisms healthy and preventing diabetes way before the typical diagnosis. So what happens? Phase 1, we're eating more carbohydrates or sugar than our body actually needs. We still have plenty of insulin, and so the cells are taking up the extra sugar, triglycerides, and cholesterol that is being produced. In phase 2, we're eating more carbohydrates or sugar than our body needs. There's still plenty of insulin, but the muscle cells are the first cells to become resistant to insulin. So then they say, hey, why don't you head on down to the fat neighborhood? They'll take up plenty of sugar and insulin still, and so your fat cells start to take up all the excess sugar, triglycerides, and cholesterol. This is when we see weight gain. Phase 3, you're still eating more carbohydrates or sugar than your body needs, but there's still plenty of insulin. Now all the cells in the body, including the fat cells, are starting to become insulin resistant. This is when we see triglyceride and cholesterol levels increased, but little change in weight. So when we start to see triglycerides and cholesterol go up, this is a big warning flag to say, hey, let's focus on reversing this and getting our metabolism healthy again now, before we start to get to the next phase, phase 4. Still eating more carbohydrates than your body needs. All cells are becoming more insulin resistant. You have high levels of triglyceride and cholesterol that have been toxic to the beta cells of the pancreas, which are responsible for secreting insulin. And so you start to release less insulin. Your blood sugars start to increase now, and you have little change in weight. This is often the very first time we start to look at diabetes in our culture. And then finally, phase 5, we're eating more carbohydrates or sugar than our body needs. High levels of sugar, triglycerides, and cholesterol have been toxic to the beta cells of the pancreas. So the pancreas will, over the course of varying amounts of time for different people, will start to release less and less insulin. And then finally, when it stops releasing insulin, that's when we see rapid weight loss. And type 1 diabetes is now the diagnosis. So just to touch on how prevalent diabetes is becoming in the world, I would say largely due to the low-fat craze, which has caused us all to eat more carbohydrates and sugar and less healthy fats. Why do we care? It's an expensive disease. It has many accompanying disease states that come along with it that are expensive. They're expecting in 2050 that diabetes will cost $2 billion a day worldwide. Okay, what kinds of diabetes are there? Type 1 is when the pancreas stops secreting insulin. We talked about it earlier. It's usually diagnosed in children and young adults. It's an autoimmune condition. The cells of the pancreas are destroyed by our own system. Type 2 diabetes, characterized by insulin resistance. It accounts for over 90% of the cases of diabetes in the U.S., and this is very important to realize. It can be reversed. There's a lot of doctors out there doing this now, and we would be happy to help you if you want to be one of those people that want to reverse the disease. Gestational diabetes is in pregnancy, and it usually occurs in the second trimester. It does increase the risk of having type 2 diabetes after pregnancy. Many of us are already familiar with how diabetes presents itself. If you'd like, you can pause this slide and look it over a little longer. Pathophysiology. So type 1 diabetes is autoimmune destruction of the beta cells of our pancreas. Studies have shown that eliminating milk protein and increasing essential fatty acids can reduce the rate of type 1 diabetes for infants who are considered at high risk. We also know that long-term pesticide exposure can increase the risk of type 1 diabetes, lupus, and other autoimmune diseases. There's probably a lot more environmental factors here, but to actually pin them down and link them to the disease literally takes millions of people and a lot of time. So there's probably something more going on out there than we already know. We can't actually say that it's been studied. So type 2 diabetes is characterized by a combination of insulin resistance and a relative lack of insulin secretion, with progressively lower insulin secretion over time. It's often accompanied by other conditions like we alluded to earlier, high blood pressure, high LDL cholesterol, high VLDL cholesterol, and low HDL cholesterol, which the HDL is the good cholesterol that is very protective of cardiovascular disease. Okay, just want to make sure that we're really clear. Insulin resistance is not the same as type 2 diabetes. Although all type 2 diabetics do have insulin resistance, Insulin resistance is a pre-phase that occurs beforehand that we want to talk about. In order to have a healthy metabolism, you want to reduce insulin resistance. So how does it happen? The cells of the body do not respond appropriately to insulin. This can be either because direct insulin resistance at the cellular level, or it can also be because we are releasing too many counter-regulatory hormones. These are these hormones on the slide here that we're going to talk about. They're important hormones in our body, but when we are releasing them way too often due to different stressors, it's actually very unhealthy for our body, and it leads to insulin resistance. So we're going to spend some time talking about that. These medications in the chart also do increase insulin resistance and the development of diabetes. Okay, just a little touch on what is insulin. Insulin is this molecule that gets glucose into our cell. It's released by the pancreatic beta cells in a response to higher blood sugars, as high blood sugars are toxic to many areas of our body. Insulin is a very important hormone. It helps us rebuild. Having functional biochemicals, hormones, enzymes, neurotransmitters, insulin is essential to the building blocks that are important for our body. However, high levels of insulin are associated with an increased risk of cancer. So it's important to recognize the more sugar and carbohydrates we eat, the more insulin we need to get those into our cells, the more we're increasing our risk of cancer. Okay, what are the counter-regulatory hormones? The first one that we have to talk about here is glucagon. It is catabolic. So as opposed to insulin, which is builds our biochemicals up, these counter-regulatory hormones tear them down. If you'd like, you can pause and look this slide over a little closer. More counter-regulatory hormones would be adrenaline and noradrenaline. These are released in response to the fight or flight syndrome. These chemicals can be released for physiological or psychological reasons, such as emotional traumas, loud noises, bright lights. Pain will release these hormones. Sleep deprivation will release these hormones. Also important to recognize nutritional. Skipping a meal or not eating enough is going to release counter-regulatory hormones into your body. We're going to talk about this over and over. If you want to have a healthy metabolism, you will never skip a meal again. You can have chemical triggers. Sugar, caffeine, alcohol, tobacco, many medications all increase the release of these counter-regulatory hormones. Physiological could be overtraining. Overtraining is going to release counter-regulatory hormones, which are not conducive to building important nutritional factors in our body. Catecholamines tend to use up our functional and structural biochemicals. It is essential to have balanced levels. Too low or too high will increase disease, including osteoporosis, and it'll affect blood sugar. So what is the result of releasing these catecholamines? High blood sugar. And these are the various ways that we get higher blood sugar. They also affect our cardiovascular system, increasing heart rate and stroke volume, and increasing blood flow to skeletal muscles and delivery of energy nutrients, which is great in a fight or flight response, not good on a chronic or daily basis. Another counter-regulatory hormone is cortisol, also catabolic, tearing our important structures in our body down. It's produced by the adrenal glands and triggered by all the stressors that we just talked about. It stimulates the production of glucose, mobilizes amino acids, and inhibits glucose uptake in the muscle and fat cells in order to allow our brain to function in fight or flight. How do we diagnose diabetes? Pretty common chart that you've seen before. I like to focus on the fasting blood glucose levels, and down at the bottom you'll see for every point of increase of a fasting blood glucose between 90 and 100, there is a 6% increase that you will develop diabetes in the next few years. This is a sign that you may have a damaged metabolism. It's the best time to take note and take steps to improve your metabolism and help prevent diabetes. So focus on those blood sugars between 90 and 100 when you're fasting. Those are the ones we want to take note and see if we can reverse. The risk factors for type 1 diabetes, family, genetics, geography, all have implications for developing type 1. For type 2, age over 45 years, although with our low-fat, high-carb diets, we're starting to see that creep down a lot, which is frightening for the picture of healthcare. Having a waist size of 31.5 inches or more for women, 35 for Asian men, and 37 for white or black men is definitely a risk factor for developing type 2 diabetes. Having a primary or a close relative with diabetes. Habitual physical inactivity. A high carbohydrate diet, especially high glycemic index foods that increase blood sugar rapidly. So basically simple carbohydrates or sugar. Stress is a risk factor. Gestational diabetes. There are populations or ethnic populations that are at higher risk. And polycystic ovarian disease. We definitely have a lot that we can do for that particular disease, so please come talk to us if you have any questions. What are the complications of diabetes? Many of you are already familiar with this. High blood sugars are toxic and damaging to the cardiovascular system, the nerves, the kidneys, the eyes, to the skin, and to the feet, including amputations. These are going to be slides that go over these various conditions. Please pause and take a moment to look at them if you'd like to learn a little bit more about those potential conditions from high blood sugars. Management and treatment, many of you know the basics for how we're going to treat diabetes, so we're not going to focus on that at all. We are going to go down and focus on the bottom there, lifestyle modifications. So, hypoglycemia, this is the symptoms, or these are the symptoms. I do like to point out that as a diabetic has their disease longer and longer over time, they lose their ability to tell when their blood sugar is dropping low and they have hypoglycemia. How do we treat it? Here's the simple way. I like to also point out that rapid change in blood sugar is very likely to cause nausea. That's very common. This slide just talks about the different ways that we will help a diabetic treat their condition. Once again, we are not going to focus on this today. Foot exams are very important for diabetics. A couple slides on that. And then here we go, we want to focus on how do we modify our risk for developing diabetes and improving our metabolism. Well, one of the biggest things you can do is physical activity. There's lots of studies showing that this is going to help reduce your diabetic risk. We know it reduces cardiovascular risk factors, contributes to weight loss, and improves well-being. And physical activity reduces stress. That reduces the release of those catabolic hormones that we were talking about. I also love to touch on the fact that high-intensity exercise can be even more effective, especially in a pre-diabetic or a diabetic. There was actually a study out there that showed that two diabetic groups were broken up into a high-intensity group and a regular exercise group. The high-intensity group got onto a stationary bike and they pedaled very hard for 30 seconds, rested for 4 minutes, and then pedaled very hard for 30 seconds, doing that 5 times, that little interval. And the regular exercise group did just 20 minutes on a stationary bike of continual pedaling. So the high-intensity group literally only had 2.5 minutes of high-intensity exercise over their 20-minute period. And that group actually had lower blood sugars and lower insulin secretions at the end of several weeks of study. So it is important to recognize that there can be ways that we can exercise that are better for diabetics. And also here's some studies that you can refer to as well. So physical activity recommendations, is it the case for all children, children with diabetes or pre-diabetes should be encouraged to engage in at least 60 minutes of physical activity every day. Adults should be advised to perform 150 minutes a week of moderate intensity aerobic physical activity, spread out over at least 3 days a week. And they're saying with no more than 2 consecutive days, and that is if you are exercising hard enough, we want to make sure not to make it a stressful thing to your body. If you're doing just a nice light to moderate activity, it's not going to hurt to be doing it every day. In the absence of contraindications, adults with type 2 diabetes should be encouraged to perform resistance training at least twice a week, and that's where we're talking about high intensity. It's very good for pre-diabetics. Okay, so non-pharmacological treatment, nutrition. Okay, this is going to be the single biggest thing that you can do to address metabolism. Overall goal is to decrease simple sugars and increase fiber. So we want to eat balanced meals, ideally fresh, organic, and chemical-free. The chemical-free part reduces the release of those counter-regulatory hormones that we were talking about. Every balanced meal should have a protein. Especially if you are a pre-diabetic or a diabetic, you must have protein every time you're putting food in your mouth. So good proteins are fish, white meat, seafood, eggs, nuts are great for snacking. You want to eat non-starchy vegetables, they're best. And simply rinse them off with Dawn dish soap. It'll remove those chemicals. Carbohydrate intake should only be based on your current metabolism and activity level. Our culture definitely is stuck in this carbohydrate craze, which oftentimes we just don't need all the carbohydrates that we're taking in. For healthy fats, look to saturated or polyunsaturated, so cold or pure pressed. Those are great fats to consume, including things like avocados, good superfoods. Really important as far as nutrition is never skip a meal again. It's best to be eating something every 2 to 3 hours, and snacks should at least have a protein and a carbohydrate. We definitely have charts for way to snack and eat healthy. If you'd like some of those charts, stop by and see us. Eat real unprocessed foods as much as possible. This is how we talk about shopping around the outside of the grocery store. Shop on the perimeter. You're going to get real unprocessed foods out there. Eat solid food. Drinking instead of eating your meal leads to hormone imbalance. Drink plenty of water. Avoid artificial sweeteners and fructose. If you really need a little bit of sweetener, which a lot of us enjoy, a small amount of honey or stevia is a great way to get that. Avoid milk. If you are looking at improving your metabolism, milk is high in sugar and hard to digest. It's got casein in it, one of the most inflammatory proteins you can put in your body. If you have any kind of an inflammatory condition, one of the most simple things you can do is reduce or avoid milk completely from your diet. Substitute almond milk. You'll find it'll help a lot for inflammation. Almond milk still does have plenty of sugar though, so just want to keep it on a very minimal part of your diet. If you are wanting to reduce your, or I should say prevent or reverse your diabetes, avoid fruits and vegetable juices. They are high in sugar. You can occasionally eat the fruits and vegetables. They're very healthy for you. And as a person with a healthy metabolism that doesn't have a fasting blood sugar that's high, you can partake in fruits and vegetables. I encourage you to always mix them with a protein. So if you're going to snack on something like that, add a protein in. Lastly, just changing your diet may be daunting. We do have guides that we can share with you happily, but you may want to consider emails. It's a great app for helping you change your diet. And I personally use it, and I could go on for 5 minutes about how wonderful this particular app is. As far as lifestyle modifications and nutrition, we're going to get a little more detailed here about if you actually want to reverse type 2 diabetes or reverse your insulin resistance if you're one of those with a fasting blood glucose between 90 and 100. If you go to this particular level of watching the amount of carbohydrates and protein that you're taking in, you can reverse your disease and then potentially loosen back up again to where you're allowing a little more, fruits and vegetables and kind of things. I always want to point out, don't forget healthy fats. They're a very important part of our diet. Limit fruit and avoid gluten. Gluten is hard to digest and it's stressful to our body. It encourages the release of those counter-regulatory hormones that we talked about. Okay, what can you do for nutrients to help have a healthy metabolism? First thing you always want to have is a multivitamin and some vitamin D. Those are the top two most important things. If you were to forget everything else, those two are the most important. It's important to get your vitamin D levels checked if you're replacing it. So at least maybe once a year or every other year, ask your doctor to check that. Your target level should be 50, I would even say to 85, they're saying more now. And then these other supplements can really be helpful. Inositol powder has been shown to be almost as effective as metformin at lowering blood sugars, so it can have a very profound effect. All of these things can help reduce blood sugars. Okay, how do we manage stress? We spent quite a few slides there talking about how counter-regulatory hormones increase our blood sugar, and stress is what causes the release of those counter-regulatory hormones, the hormones that tear your body down. And so how do we manage this? Well, you do want to get 7 to 8 hours of uninterrupted sleep. 7 is the magic number for health, so you always want to make at least that your target as a very minimum. When you think about it, you spend at least 16 hours of your day breaking your body down and tearing it apart. The sleep is the 8 hours that you get to rebuild those important biochemicals and those important hormones and everything. You want to be building them back up. So decrease stress triggers. Eat small, frequent meals, like we said, every 2 to 3 hours. You want to chew your food until it's liquid in your mouth. That reduces stress to your body. You want to avoid chemicals. They're going to release counter-regulatory hormones. And don't over-exercise. You want to make downtime a daily practice. So this is different for every different person. How do you get downtime? Is it massage, meditation, reading, working on hand projects such as quilting or macrame? There's so many different hand projects that you can partake in. Light exercise, going for a walk, do whatever works for you, but downtime should become a daily goal. Embrace a positive outlook. There's a lot of ways to do this. I would really encourage people to get very active about trying to change your outlook to be a more positive. Reflect on things to be thankful for. Increase your time with people or activities that you enjoy, and decrease your time with people or activities that you don't. Seems simple, but you need to make a conscious effort. Recognize if you have the power to change what is causing you stress. You can only control yourself and your response. You have little to no control over others and their behaviors, and there's really no reason to stress over those. Lastly, improving your nutrition will be helpful to decreasing stress. It will allow you to slowly build biochemicals that will allow you to react normally to stress. So this is really important. Most of us, as we've went through stress and tore all these important biochemicals down, improving your nutrition will help you build those back up and actually help you in your response to stress. Okay, this is all kind of daunting. So what do you do first? So everything we're going to do is we're going to try to decrease stress to our metabolism and decrease the release of counter-regulatory hormones. So the first thing that you should work on as your goal is to work on nutrition. This is the most important step of all and is going to have the most profound impact on your metabolism. You must work on building up the biochemicals that you've been breaking down throughout your lifetime. You will only build proper chemicals through proper nutrition. And please remember, too many carbohydrates is stressful to your body. They are stressful. Second, after you feel like you have managed the nutritional part, which I would say is probably going to take a month or two, and that emails app can be very helpful to just kind of feel like you have a good grasp on nutrition. It could even take up to 6 months. And then second, manage your stress. So first focus is how do we get a good diet and nutritional life habit happening. Second, we're going to focus on decreasing stress. So prioritize your life and get enough sleep. So you must get 7 to 8 hours a night to heal your metabolism. After you feel like you've actually made a conscious effort on reducing stress and having downtime and getting sleep, then third, then you want to actually think about maybe removing some of the chemicals out of your life, such as caffeine, alcohol, nicotine. This is the time to think about getting rid of those chemicals that are going to increase counter-regulatory hormones, or at least reducing their use to a minimal level. And lastly, or fourth, you want to go ahead and now finally, after all three of these other stages, focus on an exercise program. Interval or cross-training is ideal. We have a lot of great places in La Grande that you can go and work out with others. It's a great way to increase your success and make a daily activity more of a routine, or at least 4 times a week. This will become easier. Exercise will become easier after you have been on a nutritious diet long enough to rebuild all the biochemicals that your body needs to be able to exercise. And then lastly, we can also look at your hormones and your hormone balance and focus on hormone replacement therapy. This is something we specialize on at Red Cross Drug. We can help you do this. We also offer other Wellness 101 discussions that you can view and listen to on our website. So go ahead and take the time if you want to hear the ones about hormones or thyroid. Take the time to listen to those as well. Lastly, what to expect. As you start to correct your metabolism with lifestyle changes, you will very likely gain weight for 2 reasons. First, your cells have been starving. You are starting to build important functional and structural biochemicals that you've likely been breaking down for a long time. And second, muscle weighs more than fat, and your muscle cells will start to eat again as you get a healthy metabolism. So we always like to help people understand the initial phase of getting healthy often involves actually gaining a little weight. It may be hard to see that, but it's nice to know that when it happens, it's for a reason, and it is in your progression towards getting a healthy metabolism and losing weight. It may be wise to try and change only one lifestyle habit at a time, kind of like we talked about in the previous slide of the progression of how to do this. Trying to change too many things at once can often lead to failure. Still feel like you need a roadmap? I recommend reading Dr. Schwartzbein's Principle 2. She will help you identify the plan of action that works best for you and your metabolism, as well as she will give you meal plans. Keep in mind that you are trying to become healthy. You're not just trying to lose fat weight. If you try to lose fat weight before you become healthy, you are damaging your metabolism. Be consistent, and your new lifestyle habits will get easier over time. Always remember that you must first become healthy to lose weight, not lose weight to become healthy. Thank you for your time, and we hope to see you soon at Red Cross Drug.